Douglas County is not rich, does not have the reserves that the state does. How are you feeling about the budget situation? I mean, you already have a very thin police department considering the amount of square miles you cover. When does it become terminal? When does it become terminal for the county to continue to offer just the basic functions at this point?
We have the benefit, and please bear in mind, I'm here as a private citizen, but do have some insight into the county,
Right.
So I'll respond as such. We have the benefit of having a board of commissioners that is made up of business people, and we reacted immediately, literally within the first week of the stay-home order, to put a continuity of government plan into place, which meant how do we provide essential services. And we issued a directive to all department heads and elected officials to submit a budget with a 10% reduction over the current written budget. That being said, we also are anticipating up to a 30% loss in revenue potentially out of this. And so we're positioning ourselves to maintain the highest level of service we can, given the unknown circumstances of the income. As Sheriff Burnett had alluded to, we run 2 months behind actual numbers that come in. But this very well could cause a reduction in law enforcement on the street. We've had to suspend some of our officer trainees going through the basic law enforcement education, simply because it's not open, not because we don't have a desire to, but it's not available to do such. So that puts that hiring process behind, and it puts more burden of stress on that team. So we're doing what we can to make sure we can assure services to the citizens that we serve. That's our top priority. Well, actually, our top priority is the safety of our citizens and our staff, and then the second is to assure those services. But it's to be determined. We don't know. What I do know, the longer that we wait, the more damage will be done to the community, mentally, economically, and in physical health. There is a tremendous negative psychological impact in our valley right now. People are frightened, and they need to be reassured. They need to be confident that we have extraordinary medical facilities, clinicians, doctors, public health officials who are working enormous hours to make sure that we can provide those personal protections to them while opening up the economy. We've had discussions, sometimes daily, on how we can approach this, and we have positive information from the medical community and the public health community that exercising proper cautions, we can in fact do this safely.